No matter where I go in America, I'm hearing some of the most horrendous stories about how people are being reduced to poverty because of changes in their health care status. More and more Americans are finding out that they can't afford to be sick and they can't afford to be well, and insurance companies are making money not providing health care. I mean, that's exactly the direction this country finds itself in. How do we get in a condition where people can't see the doctor of their choice, doctors can't provide the treatment they want, insurance agents end up intervening between the doctor and the patient, and all of medicine becomes about profit and not about people? You, and you, and you, and you are already paying for a universal standard of care. You're already paying for it, but you're not getting it. Let me explain to you why this is true. The United States right now spends $1.6 trillion a year on health services. If all that money went into health care for the American people, let me tell you what we would have enough money to pay for. We would have enough money to pay for all medically necessary care for all Americans. In addition to that, fully paid dental care, fully paid vision care, fully paid mental health care, fully paid long-term care, fully paid prescription drugs, fully paid for complementary alternative preventive medicine would all be paid for. So many of us who have experienced the chance to work with alternative medicine or complementary medicine or preventive medicine know that when we take more responsibility for our own health, we sometimes have a path, we discover a path that works for us, and it's much cheaper than a lot of the conventional allopathic medicine, and we therefore have the opportunity to actually participate in our own healing. It's a marvelous thing. These insurance policies, most of them, nowhere near will they cover. They won't even touch this. Because why? There's not a lot of profit in it. Now here we are, all painfully aware of the high cost of prescription drugs. You would think that the government would go in the direction of trying to lower the cost of prescription drugs. But this administration took cost containment off of what the drug companies will charge Medicare to provide prescription drugs, and as a result have created a condition where Medicare will be destroyed. I believe that Oregonians who are familiar with a whole range of healthcare issues have the opportunity through this campaign to help send the Democratic Party in a direction of a serious discussion about a national health care plan where we're already paying for this. We're just not getting it. We recognize that the only way we can do this is to set aside the interest of the insurance industry, set aside the interest of the pharmaceutical industry, and start upholding high the public interest, the interest of people in this country to have health care for all. Hold that up.